Time now for Morning Rounds, our look at the medical news of the week. We know the detrimental effects of air pollution can have on our environment, but what about our health? A study out this week from the New England Journal of Medicine examined how older Americans are adversely impacted by air pollution.
The authors examined data from 61 million Medicare beneficiaries from 2000 to 2012. That's more than 96% of Americans aged 65 and older. They found in part that long-term exposure to certain levels of air pollutants increased the risk of death. Joining us from Los Angeles to discuss the findings is CBS News contributor Dr. David Agus. Doc, good morning.
Good morning.
So beyond that headline, what are the key takeaways from this report?
Well, the takeaways from the report are pretty simple, is that ozone and fine particulate matter, which are from emissions and from burning hydrocarbons, that in the air, they can actually increase the rate of death in the elderly. And what's amazing about this study is they showed that it was at levels that we consider safe now. Even at those levels, if we lower them, we would save thousands of lives a year. So it's not as safe as we thought.
David, when it came to sort of measurable pollution levels in the U.S., were certain regions impacted more than others? And how's that going to change pollution strategies?
No question about it. I mean, things like the fine particulate matters are higher in the kind of the East Coast-ish area and the ozone in the left coast, although cities like Los Angeles are double whammy hit with both of them. And so we need to be aware of it, especially when there's debate in Washington about changing these levels. What we know now is that even at the low levels, they're causing problems and potentially accelerating deaths in some people.
Doctor, this is a problem in the United States, but it's certainly a problem that is not limited to the United States. It's a global issue. How well are we resourced to research the problem of air pollution?
Well, we ain't there at all. This is an amazing study because of the numbers of people looked at, and they divided the country into small little areas and measured the ozone and the particulate matters. Around the world, it's a growing issue. If you go to India and China, sometimes you can't even see across the street. There's so much pollution there. And this is obviously affecting our health. And so we need, as a globe, to start to talk about it and figure out ways to keep it down. The particulate matters are down dramatically over the last couple decades, but now with the new debate, we're afraid they're going to start to rise.
All right, moving on to our next topic, a new initiative in the battle against cancer. According to the Centers for Disease Control, cancer is the second most common cause of death in the United States. This week, former Vice President Joe Biden and his wife, Dr. Jill Biden, launched the Biden Cancer Initiative. Dr. Agus is on board of the nonprofit. He spoke to the couple after the launch.
What I learned from our son's battle was that, and we lost him 2 years ago, not until 7, 8 years ago did we have this unity of disciplines. You have oncologists and virologists and biochemical engineers and immunotherapy, and it's all working in a way now that, in my observation, it didn't work in the past.
So, David, what are the goals of this second phase of Joe Biden's involvement with cancer?
So, you know, to me, it's inspiring that in tragedy of a family, they're taking that and trying to help everyone else and help the public. And so the goal of this new initiative is to accelerate things. Things that would have taken 10 years, they wanted to take 5 years. And they could do so by removing hurdles. Things like access to clinical trials, drug pricing, using what we call data standards, which is calling everything the same name so we can pull data and learn from it. He and his wife, Dr. Biden, and the vice president are going to work together with us to try to make a difference.
David, as Alex alluded to, Vice President Biden was involved, headed up the Cancer Moonshot, which is part of the 21st Century Cures Act, bipartisan legislation in the Obama administration. Do we need more legislation like that?
Well, that legislation was certainly important. It put a lot of resources, which is dollars, toward fighting of cancer, new dollars that weren't there before. But we need more than dollars. We need to get over some of the regulatory hurdles, some of the aspects we have with sharing of data and other things. And that's what the vice president is really going to do. In the war on cancer, we need a general. And with the vice president and Dr. Biden, all of a sudden we have two generals helping us. That is, researchers and clinicians and patients in the field achieve progress soon.
It sounds like having the vice president involved in this, a figurehead, as it were, has a measurable impact on the outcome.
No question about it. There are problems that we've had for a long time that, I as a cancer doc and the researchers, we can't overcome. But he knows how to pull the strings. He knows how to talk to the people, the different bureaus of government, and bring them together to make change. So it's very exciting to work on this initiative with him and with many others across the country to try to make an impact today. To every cancer patient, what happens today, matters, not just tomorrow.
Finally, the limits of the human lifespan. The last century saw great improvements in our longevity, but what's the maximum age a human being can attain? A study last year in the journal Nature stated that it was likely around 115 years. But the same journal published commentary this week from a scientist who refuted this claim. Part of one opposing argument said that there just is no way to know and predict what the maximum lifespan capacity could be. So the question is, will we ever really be able to know this, David?
It's certainly interesting. This researcher last year argued that if you look from the 90s till now, the highest age people achieved was around 115. And so they were arguing that we were plateauing at that level. But it didn't take into effect that we're having many new medical breakthroughs and things are changing. So 5 new studies are coming out now showing that potentially we could live significantly longer, 125 or potentially above, with these continued advances. So it's a debate. My certainly hope is it's the latter, that we're going to live longer.
It's a lot of candles on the cake, Doc. Dr. David Agus, always great to see you. Thanks for your time.
You got it, the fire hazards.
You need a bigger cake.
Yeah, you do.